So we'll be dealing with the different characteristics now of your Mycobacterium, as well as because of the increasing incidence now of MAC, or what we call now your Mycobacterium avium complex in patients having now what we call now acquired immunodeficiency syndrome, or AIDS. Okay, it is very important for us to know also the characteristics now of what we call the non-tubercle or non-mycobacterium of your non-mycobacterium part now of your aerobic non-spore forming. So this is divided now into three parts, of course. The first part here up to slide 32, I think. I will be discussing about the different again the different biochemical characteristics now of your acid fast bacilli. Okay? Sorry kasi hindi ito included dun sa biochemical test ninyo na lecture ni Ma'am Dong, kasi special yung kanilang characteristics compared now to other bacteria. The second part natin, we will be dealing now with your Mycobacterium, or your what we call now your TB, okay, MTB. And the last part will be dealing now with your non-Mycobacterium. Okay, so don't worry, we will be focusing now on the most important parts of your of your acid fast bacilli. Sorry, baka malito kayo. This is acid fast bacilli. And normally sa book kasi nilalagay nila, this is an aerobic non-spore forming gram-positive bacilli. Okay? So, but take note, itong aerobic non-spore forming gram-positive bacilli natin, this will be your acid fast bacilli. Okay? So, okay lang po ba? O nung sinabi ni Ma'am mag-lecture ako this 20, actually last week dapat to, but nasa bakasyon mode kayo. So this week sabi ko naman napaka-eager naman ng mga third year mag-aral. Kahit nasa holiday break sila talaga todo-todo sila Ma'am Dong mag-aral. So I think mag-major kayo ng bacteriology. Okay?
Mel.
Ma'am.
May klase talaga kami ng 28, 29.
Kaya nga, Ma'am, nagulat din ako.
Tinanong ko muna sila, okay lang ba sa inyo? Kasi di ba na-cancel ang 21, 22. Tapos
Yes,
parang ang ano naman, magkaklase pa ng 23. So sabi ko sa kanila, 28, 29 na lang. Anyway, may pasok naman talaga tayo. Naghanap din na may pasok ng 28, 29. So sabi ko, sige, take advantage na lang din natin yung 28, 29.
So,
okay naman sila. So, tuloy mo na, Mel.
Okay lang yan, Ma'am, para mabawasan din sa dami ng concepts ng bacteriology, Ma'am. So, okay, so let's start na. So, moving on. So, again, we will be I will be discussing about your aerobic non-spore forming gram-positive bacilli. Take note yung kanyang title. This is a non-spore forming and it is aerobic. Okay? So yung first part pala ng slide natin, nandiyan na yung kanyang characteristic ng one of the characteristics now of your Mycobacteria or acid fast bacilli. They are aerobic and non-spore forming. And this is in contrast now with your Bacillus and your Clostridium. Okay, tapos nyo na ba Bacillus and Clostridium? Tapos na lang, Ma'am Doc? Okay. So, start na tayo dito. So, yan.
Hindi pa, Mel. Hindi pa.
Madami-dami pa pala, Ma'am, no?
Marami pa, Mel.
Okay, so, yan. Kapag gano'n, may time naman ako, sabihin ko kay Ma'am Dong para mabilis din si Ma'am Dong matapos. Okay? So, we have here the major genera and species now to be considered. Again, sabi ko nga, the first part, we will be dealing now with the different biochemical characteristics as well as the culture media used now to cultivate now Mycobacterium. And of course, the second part will be dealing now with the MTB complex, and the third part will be dealing now with the non-tuberculous Mycobacteria. Take note, do not confuse yourselves dito sa mga terms na Mycobacterium tuberculosis complex and non-tuberculosis Mycobacteria. Later on, i-differentiate natin kung ano yung main point or main characteristics ng mga to. Okay? So, under your Mycobacterium tuberculosis complex, we have here the most important bacteria. We have your, of course, walang kamatayang Mycobacterium tuberculosis. Okay? So, one also of the significant species under this complex is your M. bovis. Why? Take note pa-highlight. when we talk about M. bovis, okay, this is a mild form, or the M. bovis causes a mild form now of your tuberculosis. That's why your M. bovis is used now for the development now of your vaccine for your tuberculosis, and this is called now your BCG. Kaya kung midwife ang nanay niyo, or may kakilala kayong mga nurses or midwives, take note pag binanggit nila BCG or your Bacillus calmette-guerin, normally this is derived from your M. bovis, not from your M. tuberculosis. Okay? So, um, ewan ko kung may serology na kayo, kasi when we talk about M. bovis and M. tuberculosis, sir, bakit po ginagamit yung M. bovis? Eh, di ba ang bakuna is for M. tuberculosis? Okay? Kung may, sa serology, may tinatawag kasi tayong what we call now your cross reaction. Meaning, the antigen of your M. bovis and M. tuberculosis and their antibodies, or the antibodies produced against this antigen, cross-react. Okay? So later on sa serology, matutunan niyo yung meaning ng cross-reaction. Okay? So we have here M. tuberculosis, M. bovis, of course we have here your Mycobacterium africanum, Capre, Carnetti, Microti, and Pinnipedi. So highlight lang natin yung pinaka-important dito. We have your M. tuberculosis and bovis. For non-tuberculosis Mycobacteria, ito medyo toxic kasi we will be dividing them depending now on their pigmentation, pigmentation and their growth. Okay, so we have here your slow growing non-photochromogen. Again, slow growing, matagal daw tumubo, and non-photochromogen. Pag in-expose mo daw siya sa araw, walang pigmentation. So we have here your M. avium complex. Ito yung sinasabi ko sa inyo na increasing incidence ng AIDS, because of the increasing incidence ng AIDS or prevalence ng AIDS, nagkakaroon ng tinatawag tayo nating non-tuberculous mycobacteria. And the most popular causative agent of this is not your tuberculosis, but your MAC, or what we call now your Mycobacterium avium intracellular complex. Okay, so we have also here your Mycobacterium cellatum, your ulcerans, your gastri, and your genevense. So the most important bacteria here under this classification is your M. avium complex. Again, and M. avium complex, or your MAC, and your M. intracellular. We have also here your slow-growing non-photochromogen. So, binanggit yung iba dito kanina. So, for your Haemophilum, Malmonse, Shimoidi, Senopi, yan yung mga yan. So, tingnan natin yung mga highlights ng mga to. For photochromogens, we have your Kansasi, your Asiaticum, and your Marinum. And scotochromogen, we have your Zulgai, Scrofulatium, Interjectum, Gordonei, and your Cookie. Okay. So, mahilig dito sa cookie. For scotochromogens, we have also here your Hiberniae, Lentivlavum, Constipicum, your Hexahornense, your Tusciae, Hidusciae ulcerans, and your Bohemicum. And rapid growing, potentially pathogenic for Tritum, Chelonae. So hanggang yan, Newerlense. Sorry, hindi ko in-include dito yung ating special bacteria. We have here your, under your acid fast, we have your Mycobacterium leprae. So yung last part ng slides natin, okay, so we will be discussing about your Mycobacterium leprae, the agent now of your Hansen's disease or your leprosy. Okay, so sadahan na natin to. So start tayo dito sa part or first part ng ating discussion. We'll be dealing now with your specimen collection. Okay po ba? Nasa specimen collection na po ba kayo? Na slide? Baka naglalag kasi po. Ox lang po ba?
Yes, sir.
Okay. Huwag kayo matulog, Huwag kayo matulog, sayang yung ganun, sayang yung at least kunti lang i-review nyo. Kasi yung ganun nyo naman, yung mga handout nyo naman, ito lang din naman, discuss lang natin yung pinaka-important part. Pero ano kayo paano mag-aral ng mga important parts na ito, okay? So, start tayo with your specimen collection and transport. Okay? When we talk about acid fast or your mycobacteria, the first thing na pumapasok sa isip natin would be your sputum, right? Diba? Pag sinabi mong sputum ay for acid fast, okay? But take note, hindi lang po limited ang sputum natin for acid fast. But majority kasi, lalong-lalo na ating M. tuberculosis, kinakailangan natin will be your sputum. Okay? Again, specimen collection and transport, yung container natin. For our container, take note, the recommended container is a sterile, wide-mouthed cup with a tightly fitted lid. So take note, this is highlighted now on the slide kasi ito yung pinaka-importante sa board exam. Ito yung favorite nilang tanong. Actually, ang favorite nilang tanong sa board exam, please focus on your analytical, and your analytical technique. Okay? So, before or prior to specimen collection, during specimen collection, transport, as well as during specimen processing and reporting. This is the very the most important parts of your microbiology as well as in other professional subjects. Okay? So, kasi ito yung ginagawa talaga ng medtech. Okay? So, take note, sterile, wide-mouthed cup with tightly fitted lid. Fitted lid. Okay? So, delayed longer than 1 hour. Ano gagawin natin? Take note, refrigerate at 4 degrees except now for blood collection. Okay? So, for blood. Sir, bakit may blood? Take note up, when we talk about tuberculosis or Mycobacterium tuberculosis, normally kasi iniisip natin palagi will be lungs or associated siya sa baga. And yun yung tinatawag nating intrapulmonary. And we have the term extrapulmonary, meaning outside your lungs. So, for specimens, okay, from extrapulmonary infection or extrapulmonary TB, normally pwede yan blood, pwedeng mga fluids ninyo, yan. Pwede din, of course, pwede din sa bone kasi may TB din sa buto. Later on, babanggitin natin yung mga yan. Okay? So, for respiratory specimens natin, lalong-lalo na for intrapulmonary TB, yung patients natin suffering from intrapulmonary TB, we have here your, of course, expectorated sputum. Okay, sputum. We have your normal saline nebulized induced sputum. In case na maarte yung pasyente, hindi daw siya maka-expectorate ng sputum. Yan, pwede mong gawin normal saline nebulized induced sputum. We have your transtracheal aspirate. Okay, so bronchoalveolar lavage or your BAL. Okay, so we have also here your bronchoalveolar washing, laryngeal swab, and your nasopharyngeal swab. Okay, but of course, the most popular specimen used now is your expectorated sputum. Okay? For body fluids naman, for in case the patient suffering from extrapulmonary TB, we have here your pleural fluid. O tapos nyo na ito sa inyong AUBF, I think, sa tapos nyo na sa CM ninyo. Pleural fluid. We have your pericardial fluid. Of course, we have your joint aspirate from your synovial fluid. Okay? So we have also your peritoneal, your CSF. Okay? CSF, I think tapos niya na din sa CSF to yung tubercular meningitis. We have also stool, yan, urine, and pus. Okay. For body tissues naman, ito yung sinasabi ko sa inyo, we have your blood, but for blood, in case of delay, do not refrigerate. We have your bone marrow, mga biopsy specimen, your solid organ, biopsy din, lymph node, your bone, in case na bone TB, and of course, we have your skin. Okay, normally for skin kasi we have here your Mycobacterium leprae, skin nips ang tawag natin dito. Okay? So, okay po ba? Again, for respiratory specimen, normally limited to for extrapulmonary TB. Intrapulmonary TB. For extrapulmonary TB, we have here other specimens natin, mga body tissues and body fluids. Okay. So, start tayo dito sa sputum. Again, favorite. Preferred specimen natin will be early morning specimen. Again, early morning specimen collected on 3 consecutive days. Ideally, 3 consecutive days, but tinanong ko yung mga medtechs na kakilala ko nag-training sa DOH, normally kahit 2 specimen na lang on that day. Again, on that day. So, early morning specimen collected on 3 consecutive days. May ganun po, may naka-unmute. So, sorry po. So, we have here early morning specimen collected on 3 consecutive days. But today, in case na lumabas sa board exam nyo, walang ganitong sagot, ang next nating option dito, kahit 2 specimens collected on the same day. Okay? So, method of choice, again, expectorated or spontaneously produced sputum and required volume 5 to 10 ml. So my favorite board exam question kasi dito actually wala sa slide na ito. So I need a volunteer. Okay, so tingin tayo. Yeah. Dave Ikin, paki-unmute mo yung sarili mo, Dave. Dave, nakaturog na si Dave. Dave.
Dave.
Nakaturog na siya, ma'am.
Nag-good afternoon pa siya kanina eh.
Na- Nakatulog si Dave. So, tingin tayo ng ibang tao. So, uy, si Kirby. Yan si Kirby. Kirby, gumabay. Unmute mo na yung sarili mo, Kirby.
Sir.
Oo, di ba? Parang kakagising mo, Kirby. Sure. Okay, Kirby. Okay, so sa tingin mo to, ano yung sa tingin mong sagot dito, Curbs? Wala dito sa slide na to, but kailangan mo dito ng ganun lang, ng common sense lang to, Kirby. Okay? Ano ba ang purpose? Ano daw yung una mong gagawin? Okay, ano yung the first thing to do or you should instruct now to your patient before collecting now sputum? Ano yung first thing na dapat instruct mo sa kanila? Go, Curbs. Hula lang, Curbs. Wala namang ganun dito, Curbs.
Sir, dapat po,
Dapat? Hula lang, Curbs.
dapat po may sir, mucoid, something, sir.
Okay, yun ang instruct mo. Okay. Actually, ang sagot dito, so wala sa slide na to. The first thing to do dapat ng pasyente, okay, is to gargle. Imagine mo yun? Okay, sa tingin mo, Kirby, bakit kaya to gargle? The first thing to do dapat ng pasyente.
Sir, para matanggal yung other interference na bacteria po.
Good. Yung normal flora natin. Take note. Okay,
Yes,
thank you,
sir.
Kirby. Thank you.
Yes, sir.
So, in case na lumabas sa board ulit yung question na yun, the first thing na dapat gawin ng ating patient will be to gargle. Okay, and the main purpose now nung step na yun is to remove now yung tinatawag nating normal microbiota or your normal flora. Okay? So, again, required volume dito is 5 to 10 ml. Okay? Deep cough, take note, it is a deep cough, expectorated sputum, or aerosol or hypertonic saline induced. Normally, deep cough. Okay? So, normally, kailangan natin i-distinguish yung difference between a sputum and of course, saliva. Okay? So, we have here, under microscope dapat, okay, pagtingin mo ng specimen mo after processing, dapat ang inyong squamous cell will be or squamous epithelial cell will be less than 10. Okay? So, should be less than 10. At ang inyong macrophage or your pus cell should be greater than 25. Pag greater than 25 ang inyong pus cell and less than 10 ang inyong squamous epithelial cell, meaning this is a ideal sample, this is a sputum. Okay? Kapag baligtad, greater than 10 or greater than 25 ang inyong squamous epithelial cell or less than 10 ang inyong pus cell, meaning ng specimen natin will be saliva. Okay? So, specimen natin will be saliva. So, take note, sabi niya dito, 2 of the first 3 sputum direct smears positive, meaning confirm your diagnosis. Okay? So, kapag yung first 3 sputum direct smear natin, tinatawag natin sa rural health units na DSSM or direct sputum smear microscopy yung method natin. Okay? So, yung first 3 sputum smear natin, silang tatlo nag-positive, ibig sabihin, i-diagnose na yung patient as positive for TB. Okay? In case naman na none, doon sa tatlong sputum, none, walang nag-positive, and only one or may isang nag-positive, request for additional specimen. Take note, wag nyo agad sabihin negative, makakauwi na po kayo. No. Okay? Request for additional specimen. Normally, hindi, ang senaryo kasi hindi na ganito nangyayari eh. Kasi in case na negative siya, but suggestive na meron siyang TB, lalong-lalo na positive or sa x-ray niya nakita mo suggestive na may TB kasi normally ang diagnosis natin will be chest x-ray plus your DSSM. Okay, your chest x-ray plus DSSM. Meaning pag negative siya sa inyong DSSM or your sputum smear, okay, at positive siya sa inyong chest x-ray, ibig sabihin nun, kino-confirm na natin siya using now a rapid tool or rapid technique and which is now your gene expert. Mamaya banggitin ko sa inyo yung gene expert. Hindi agad pinapa-uwi yung pasyente. Though, ang dictum nating mga medtech is to cease to believe. Dapat nakita mo sa smear merong acids, pus, bacilli. Hindi sa lahat ng pagkakataon may makikita tayo. Okay, and we have your gold standard technique or gold standard method now for the identification of your TB. Normally is your culture. Ang problema natin for culture, okay, ang problema natin for culture, matagal po tumubo ang TB. Maabot normally to ng 1 month up to 3 months bago po natin makita ang growth ng ating TB. That's why may mga improvements na po ngayon sa diagnosis or diagnostic test, and we have here now your gene expert. Later on pag-usapan natin si gene expert. Okay? So next natin, we have here, aside from your sputum, we have your gastric aspirate or washing. Okay? For gastric aspirates natin, for to recover ng mycobacteria swallowed during night. Okay? So sa kadugyutan nyo nung ginagawa nyo, pag nag-cough out kayo, kapag may nandiyan yung crush nyo, sinaswallow nyo ulit. Okay? So, actually, dito nabubuhay ang ganun, Ascaris lumbricoides, para makompleto yung life cycle niya. Ganito yung nangyayari. Okay? So, take note. We have also here, sabi niya dito, used for patient who do not produce sputum by aerosol induction. Children younger than 3 years. Specimen of choice natin dito, gastric aspirate. Take note. Senile non-ambulatory patient, gastric aspirate pa rin. So, 3 specimens within 3 days. Kailangan natin ng 3 specimens within 3 days. Required volume, 20 to 25 ml. Okay? So, medyo mahirap to kasi, of course, doktor na gumagawa nito, gastric aspirate, compared din sa ating sputum na pwede mo lang instruct yung pasyente na mag-cough out ng sputum. For urine specimen, for extrapulmonary TB, we have here, first morning midstream specimen. I think tapos nyo na to kay Ma'am Gil or Ma'am Ethel ang inyong teacher. So, Kay Gangan, kindly unmute yourself. Kay Gangan. Uy, tulog din si Kay Gangan. Hala, katurog kayo Okay. Burigsay. Ay, wala siyang mic daw. Okay. Burigsay. O, baka walang mic lahat, Burigsay Ria. Burigsay, patingin nga ng mukha niya. Yan. Burigsay Ria. Unmute ka na.
Yes, sir.
Okay, wow. Talagang pinaghandaan mong recitation, So, so we have here your urine specimen, sabi niya dito. Okay, tapos niyo na to sa EUBF. Sa tingin mo, anong reason kung bakit first morning midstream specimen na ginagamit natin? Briggs High?
Sir, first morning midstream.
True.
Kasi po, di ba, yun po yung usually ginagamit for culture.
Bakit? Bakit? Bakit nga? Bakit hindi pwedeng random na lang?
Pag random, sir, mas madaming contaminant, char.
Kaya nga midstream siya kasi to reduce contamination. Bakit siya
Yes,
first morning? Anong reason bakit first? Sa lahat ng specimen niya sa urine collection, bakit kadalasan mas maganda ang first morning?
First morning, sir, kasi di ba pag sa gabi, since naiipon lahat, tas yung unang ihi sa umaga, nandun na.
Oh, good. Tama. Yun ang tamang sagot. Take note. The concentration din, ang purpose natin dito will be your what we call your concentration. So mas concentrated or more concentrated ang first morning midstream clean cuts natin compared now to other specimen like your random. Okay, so yan yun. So first morning midstream specimen natin for at least 3 days. Volume natin, entire volume or minimum now of 15 ml. So wala din problema, hindi masyadong hassle naman ang urine specimen or urine collection natin. For stool naman dito, for identification now of patient now with disseminated mycobacterial disease, primarily patients suffering from your AIDS. Okay, from your AIDS. So take note, do not use preservative for your stool specimen. Next, we have here your blood. For blood naman, again, for disseminated mycobacterial infection, say Mycobacterium avium complex. So, gumagamit tayo ng mga different systems dito. We have your isolator lysis centrifugation system, Bactec system, your Myco-F paddle. Okay, so, kamukha lang ito ng blood collection. I hope nakakita na kayo ng picture ng ginagamit natin for blood culture, yung blood battle natin or blood culture battle natin. Okay, so try nyo i-search kung sino hindi pa nakakakita. Ganun lang din po ang itsura ng ating blood culture battle. Search nyo blood culture battle. Okay, so may makikita kayo doon na parang botelya talaga siya. Okay, parang may mga beads sa loob. And of course, nandun yung ating anticoagulant. And normally, pinakakaman natin dito SPS. Depende kung ano kolektahin natin. So for your tissue specimen, again, so pleural, pericardial, peritoneal, and of course, your CSF. Okay, so when we talk about CSF kasi ang concern natin dito, di ba? Sa inyong CSF analysis, ang concern natin for your inflammation of your inflammation of your meninges or your meningitis will be, ang pwede natin i-suspect dito will be viral, di ba? Viral, bacterial, fungal, or your tubercular. Siguro natapos niyo naman yung tubercular. Okay, so in your CSF analysis, ano yung characteristic ng tubercular meningitis sa physical examination? Tingin tayo. Baloka. Baloka, pa-unmute naman nung ganun mo, mic mo. Review to ng ganun yun, ng EUBF. Baloka, nawala na siya. Okay. Patong. Uy, meron si ganun dito, Mayor. Patong. Patong, pa-unmute ka na at patong. Yala. Uy, si Sagun. Nandito dito Sagun. Sagun! Reset Sagun. Yan. Oh, yan.
Sir,
Sagun.
tanong.
Okay. Ang tanong ko, Lisette Sagun, is ganun, ano yung physical or ano yung, tawag ito, tanong ko na, ano yung makikita mo kapag tubercular meningitis physically doon sa inyong specimen na CSF?
Sir, may pelical formation.
Good. Tandaan nyo palagi yan, pelical formation. Yan, characteristic yan ng ating, thank you, Sagun. Okay,
Yes,
so,
sir.
characteristic yan ng ating tubercular meningitis. Okay? So ito yung pinaka-important points ng ating CSF analysis. Dito magme-marry yung iba't iba nating professional subjects. Okay? So we have here also volume required for CSF. We have here 2 ml. Your take note, alamin niyo din yung pagkakasunod-sunod ng different tests ninyo, different sections ninyo. Alamin ko kung pang ilang tube dapat si microbiology, si HEMA, or si CC. Okay? So we have here 3 to 5 ml for exudates, okay, and pericardial and synovial fluids, and 10 to 15 ml now for your abdominal or your chest fluid. Ulit ko lang, highlight lang natin si CSF dito. Required volume natin will be 2 ml. Okay? Okay, so for your specimen processing naman tayo, for specimen processing tayo, so the most important part for specimen processing is we have your decontamination and digestion. Okay, pa-highlight nung or pasulat ng dalawang words na 'yon. Okay, so ito yung unique na processing technique na meron sa Mycobacteria na wala dun sa ibang bacteria na pinag-aralan natin. Okay? So decontamination, and of course we have your digestion. Okay? So normally ang specimen natin dito will be sputum. Okay? So ano bang characteristic ng sputum? Mucoid, sabi nyo kanina. So because of its mucoid characteristic, it is necessary now to digest. Okay? Kailangan i-digest ang ating sputum. And of course, galing yan sa inyong respiratory tract, lower and upper respiratory tract, contaminated yan ng tinatawag nating normal flora. Yun yung reason naman kung bakit may tinatawag tayong decontamination. Again, decontamination and digestion. Okay, anong purpose ng ating digestion? Take note, to liquefy sample. Okay, so i-liquefy natin yung ating mucus. Okay, so liquefy sample through digestion now of your proteinaceous material, your mucus or your mucin. Okay, so it enables now the bacteria to use nutrient of the media. And of course, anong purpose ng ating decontamination? To kill other or non-mycobacterial organism. Okay, so yan yung purpose ng ating decontamination and of course your digestion. So yan. Yung mga reagents natin for your decontamination and digestion. Highlight lang natin yung pinaka-importante. So ang pinakasikat dito will be your N-acetyl L-cysteine sodium hydroxide. Okay. When we talk about N-acetyl L-cysteine sodium hydroxide, yung pangalawa po, so your N-acetyl L-cysteine or your dithiotretol is used as a liquefying agent. Again, pag tinanong sa inyo kung anong purpose ng ating N-acetyl L-cysteine, this is a liquefying agent. What is the purpose of your sodium hydroxide? Siya naman yung ating decontaminant. Okay, so kapag sinabing N-acetyl L-cysteine sodium hydroxide, take note, sapsapin yung dalawa pwede siyang itong buong reagent na ito is for digestion and decontamination. Ano yung reason ng ating digestion? We have your NALC or your N-acetyl L-cysteine or your dithiotretol. Sodium hydroxide naman is used for your decontamination. Okay? So in case na wala kayong N-acetyl L-cysteine sodium hydroxide, we have also here your 2 to 4% sodium hydroxide. Actually, mas effective ang N-acetyl L-cysteine kasi nga binanggit natin kanina, your sodium hydroxide normally limited siya for decontaminating. Okay? But it can digest minute amount now of your mucin. We have here benzalkonium chloride or your Zephyran. So ginagamit natin to. Your trisodium phosphate is used now as a digestant. Okay? And your benzalkonium chloride naman shortens your exposure time and destroys now your contaminants. Meaning, ginagamit natin ang benzalkonium chloride as your decontaminant. So, we have also 5% oxalic acid in case na wala talaga. So, decontaminate specimens normally contaminated now with your Pseudomonas aeruginosa. Yan, notorious yan si Pseudomonas aeruginosa for contamination. And of course, your 1% cetyl pyridium chloride for prolong the shelf life now of sputum up to 8 days. For these reagents, hindi nyo siya kailangang aralin ng husto yung iba, but take note, highlight ko lang yung N-acetyl L-cysteine sodium hydroxide natin. Again, for N-acetyl L-cysteine, ginagamit natin for your digestant as a digestant, and your sodium hydroxide naman ginagamit natin as a decontaminant. So, ganun lang po siya, pampabibo effect lang. Others, we have your sulfuric acid, sputolysin, your Clorox, your cetylpyridium, sputolysin plus sodium hydroxide, and anti-hormine. So, sir, paano natin ginagawa yan? Yung sputum natin plus yung digestant, your N-acetyl L-cysteine, yan, pag digested na siya, medyo liquefied na siya, mix and stand at room temperature, and of course, centrifuge. Take note, ang specific gravity dapat ng ating bacteria normally, 0.79 to 1.07. Meaning, siya ay magsesettle at kukunin natin yung kanyang sediment at yung gagamitin natin for smear and for culture. Okay, so take note, concentration technique ang ginamit natin dito. Like your parasitology, di ba may concentration technique tayo dito? Okay, so dito di may concentration technique tayo dito. So yan ang purpose ng ating digestion and decontamination. Tapos na ito stainings. For acid-fast staining, binanggit sa inyo dati or binanggit sa mga past lectures yung dalawang method natin. The hot and cold method. In particular, we have here your Ziehl-Neelsen and your Quinion. Okay? So, for acid-fast stains, kasi nga sabi ni Ma'am Dong kanina as an introductory part ng inyong Mycobacteria, ang unique characteristic nila is that the cell wall contains 60% or 50 to 60% mycolic acid, and this is the reason now for the acid fastness. Okay, mahirap silang i-stain because of the presence now of your mycolic acid. That's why we use now a special stain, and this is called now your acid fast stain. Okay, and normally ang ginagamit natin dito, we have your Ziehl-Neelsen and your Quinion method. Depende kung anong ginamit, the hot method or your cold method. Again, favorite board exam question yung content ng cell wall ng ating acid-fast bacteria. So we have here your mycolic acid. Okay, mycolic acid. So tingnan lang natin yung pasadahan natin yung different methods natin. When we talk about Ziehl-Neelsen and Ziehl-Neelsen method and Quinion staining or Quinion method, okay, hot and cold method. So, tingnan nga natin kung may kunti kayong na ganun. Kamayang, LM.
Sir.
Yan, si LM. Nung last LM, nagsalita ka ba? Hindi, no?
Hindi.
LM, kasama mo siguro boyfriend mo kaya ganun ka. Charot. Okay, so LM.
Sir.
Okay. Anong primary stain natin sa dalawang to?
Wait lang.
O tapos niya nito kay Ma'am Dong. Rinig ka ni Ma'am Dong.
Mababalikin ko ng micro.
Actually, napaka major subject nyo to. Take note separate ito sa board exam. Kasama niya ito ang mycology at virology. And 99%, take note, 99% ng exam question ay galing sa bakte. 1% lang ang galing sa mycology and virology or wala. Okay? So take note, aralin niyo ng buong puso ito. So LM,
Sir.
anong primary stain natin for your Nielsen and Quinion?
Carbon fusion?
Anong carbol? Usin, ikaw talaga, LM eh. LM, good LM. Ano ang counter stain natin dito? Secondary stain natin dito.
Malachite green or ano may isa? Dalawa.
Malachite green. Parehas na M naman to. Malachite green and
blue.
good. Methylene blue. Okay, thank you, LM. Okay. So, yan. We have here again for Nielsen and Quinion. Same lang halos silang dalawa. We have your carbolfuchsin as your primary stain. Okay. And we have your malachite green or methylene blue as your secondary or counter stain. Okay? So, ang pinagkaiba lang nila is the use now of steam. Kaya nga hot method ang Nielsen kasi gumagamit tayo dito ng alcohol lamp. Pinapasadahan natin yung ating slide containing now your carbolfuchsin hanggang sa magkaroon ng steam. After nun, tatanggalin natin. Okay? So, for Quinion naman, gumagamit naman tayo dito ng cold staining procedure. Okay? So, dito gumagamit ng steam. Okay, rather incorporated na reagent na doon sa ating Quinion stain. Okay? So take note bakit siya acid fast? Okay, binanggit kanina dahil sa mycolic acid. Pero saan yan nakuha yung name na acid fast? Take note, ang ginagamit kasi natin dito, unlike your gram stain, gumagamit tayo ng ordinary alcohol. Ang ginagamit natin dito will be your acid alcohol. Combination normally of ethanol plus your HCl, acid alcohol. Kaya ang tawag sa kanya acid fast. Okay, kasi nire-resist niya ang washing nire-resist niya ang washing ng ating acid alcohol. Hindi siya natatanggal ng ating acid alcohol. May marka na kumbaga sa damit namantsahan na. Once na namantsahan ng carbolfuchsin, hindi na siya matanggal ng ating acid alcohol because of the mycolic acid. Okay? So another, hindi masyadong sikat ito tawag dito sa mga old na books, si Oramine Rhodamine Fluorochrome stain. Tapos yun naman na histopath ninyo. Okay, so normally when we talk about your Oramine Rhodamine Fluorochrome stain, fluorochrome stain. Okay, so gumagamit tayo dito ng fluorescent microscope, special type ng microscope. So this is more sensitive now for the detection now of your acid fast bacilli. So again, decolorizer natin dito, acid alcohol. And take note, hindi methylene blue or malachite green ang ating counter stain, kundi potassium permanganate. Okay, so pinagkaiba lang niya sa ating Nielsen and Quinion will be the counter stain, yan, potassium permanganate. So, naka-highlight dun sa babang phrase or babang part ng slide natin. Sabi niya dito, all positive fluorescent smears are confirmed with your Nielsen on the same smear. Ito yung tinatawag nating smearing procedure sa RHU na DSSM, direct sputum smear microscopy. Gumagamit yun ng Nielsen or Quinion method. Nielsen or Quinion method. And normally, ang pinaka-most common na ginagamit, actually lumabas din sa board exam yung most na ginagamit. Pag pinagpili kayo between Nielsen and Quinion, ang kadalasang ginagamit natin dito will be your Quinion stain or your cold staining procedure. Kasi hindi natin kinakailangan ng heating dito, okay, para sa ating staining ng ating Mycobacteria. So precautions lang for AFB microscopy and staining. Smears should not come in contact with one another during staining, again, para walang contamination. Staining jar should not be used. Di ba sa ating gram stain, meron tayong coupling jar na ginagamit. Isaw-saw-saw-saw mo lang siya doon. Dito hindi po. Okay, so kailangan nating, actually, kailangan i-flood yung ating smear with your carbolfuchsin. Hindi sa natin nilalagay sa ating coupling jar. Okay? So, of course, wipe your oil immersion before reading. Baka nandun yung ating ganon, yung ating bacteria dun mismo sa ating objective. Actually, isa sa mga karakteristik ng Mycobacteria ay pwede siyang mag-float. Napakagaan niya na pwede siyang mag-float, okay, sa environment, okay? So, cause of false positive AFS. So, we have your first changes now in your cell wall. Okay, so insufficient decolorization. Okay, baka nasobrahan ka sa paglalagay ng carbolufusin, hindi mo sa na-decolorize ng mabuti ng acid alcohol, kaya hindi sa natanggal. Okay? Laboratory contamination and of course delay. False negative naman, kabaligtaran lang to na over ka sa overzealous decontamination. Loss now of your concentration technique, hindi mo na centrifuge ng maayos. Organism obscure a very thick smear, yan, and over decolorization of smear, poor counterstaining, and lack of observer proficiency in reading stains. Actually, one of the most difficult microscopy or microscopic examination is siguro tapos nyo na to sa hindi, sorry, naabutan pala kayo ng lockdown. Malaria. Okay, sa parasitology, ang hirap mag-identify ng malaria. Sa bacteriology naman, ang hirap mag-identify ng AFS. Ang hirap magbilang ng AFS. Duling ka na after mo tong mabilang. Okay, so kasi kailangan mo normally dito 100 fields. Okay, pero may mga techniques silang ginagamit dito. Of course, kapag well-trained ka na, okay, kasi may training ito sa Department of Health, okay, kasi napaka-slender ng ating MTB. Okay, so yan, sabi niya dito, lack of observer proficiency in reading stains. Huwag na yung reporting mamaya, may yung DOH ang susundin natin. Ito, for DOH, ito yung kailangan natin. Take note pa-memorize ng reading na ito. Sabi ko nga sa inyo, favorite sa board exam, mga readings. Yan. So reading scale natin sa Zia-Nielsen method or your HOT method. Pag wala kang nakita, of course, huwag mong i-report na positive yan kasi wala kang nakita, 0. Okay? Plus N, yan, 1 to 9 AFB per 100 field. Ibig sabihin, ilang field ang iyong kailangan tapusin? 100 fields. Okay. So, tanong tayo. Karag, Queen, nagturog na si Queen. Puwa. Pisha. Puwa.
Nawala na sila, sir.
True, ma'am. Okay. Sinong corpus? Corpus? Wala ng mga to.
Pa-quiz na tayo, Sir Ray.
Feeling ko, ma'am, magpa-quiz ka after nito, ma'am. Kasi dayag na lang ulit. Dayag. Very ganun to, ma'am. Very active to, ma'am.
Hello, sir.
Oo, sabi ko na. Very active to, ma'am. Okay, dayag. Dahil dyan, dayag ganun. Bigyan kita ng culture ng TV. Joke lang. Okay, dayag. Sabi dito sa reporting natin, yung pangalawang column natin, yung pangalawang row natin. Plus N daw, pag nakakita ka ng 1 to 9 AFB per 100 field, actually hindi mo siya i-report as plus N. In case nagbilang ka ng 100 fields, nakakita ka ng 8, anong i-report mo, Jovi? Jonah V.
Plus 8, charot.
Jonah V. Okay. Thank you. Take note,
Thank you.
Kapag 1 to 9 AFB per 100 field, nakakita ka ng 8, huwag mo siya i-report na plus N. Ang i-report mo, plus 8. Okay? Kapag nakakita ka ng 2 dun sa 100 fields, plus 2. Ganun lang siya. Okay? So, kapag greater than 10 na to 99, yan, per 100 field, 1 plus na siya. Huwag nyo lituhin kapag nilagay ni ma'am doon sa exam plus 1, magkaiba ito sa 1 plus. Okay? So, kapag 1 plus, 10 to 99 per 100 field. 2 plus naman, 1 to 10 per 50 visual fields. And 3 plus naman kapag greater than 10 in 20 visual fields. Okay, so yan ang kailangan yung alamin yung ating reporting. So, take note for fluorescence microscopy naman, we have here no AFB, syempre wala, for 200 times magnification and 400 times magnification. For plus N, we have 5 to 49 sa ating 200 magnification and 400 times 3 to 24 naman, we have AFB in one length. Take note, kapag kapag negative kasi kadalasan, hindi mo siya ire-report. Of course, ni-report mo siya as no acid fast bacilli or no AFB seen. And normally, ang next na ginagawa dito will be the sputum will be tested now using your gene expert. Binanggit ko sa inyo yung gene expert. When we talk about gene expert, kasi ito na yung kadalasan ginagamit natin, actually may mga RHU nang merong gene experts. Tsaka meron itong DOH din natin dito. Lahat ng regional offices binigyan ng gene expert. And of course, CVNC may gene expert din. When we talk about gene expert, nasa pangalan niya palang gene expert, normally ang principle natin dito will be nucleic acid amplification or your NAA, nucleic acid amplification. And it determines now the DNA, of course, of your Mycobacteria, as well as the DNA coding now for what we call now resistance. Okay? Sir, bakit binanggit mong resistance? Di ba binanggit ko kanina hindi mapuksa-puksa ang TB? Bakit? Whether your drug-resistant tuberculosis, may tinatawag tayong multi-drug resistant tuberculosis or Mycobacterium tuberculosis, and we have also your XDR. Hindi lang MDR na, meron na ding XDR, extremely drug resistant. Okay? And normally for gene expert na advantage nito is that it can detect now this resistance. And normally ang dinedetect nito will be your rifampicin. Kaya kung mapapansin nyo, ang sa internet ang tawag dito will be your expert dash RIF, RIF. Ang meaning ng RIF dito will be your rifampicin resistant or resistant to rifampicin. Okay? So, saan ba yung rifampicin? Take note, first line na drug yan na ginagamit natin for the treatment of your TB. Actually, may ginagamit silang coding dito ng ang mga medtech, RIPES. Okay? Yung R doon stands now for rifampicin. And nakakalungkot na isipin na yung ating mga Mycobacterium tuberculosis or yung ating bacteria, resistant na siya sa ating first line na drug. Gumagamit na tayo ng mga second line na drug for the treatment. Okay? So, and yun, the gene expert detects the gene of your TB or your Mycobacterium tuberculosis as well as the gene coding now for this drug resistance. So, ito yung main advantage ng ating gene expert. Okay, so for your gene expert, gumagamit tayo dito ng cartridge. Itong cartridge na ito, doon mo ilalagay na process mo. Di ba kanina pinrocess natin yung specimen through decontamination and liquefaction. Okay? So, after mong ma-process, ilagay mo sa cartridge. After sa cartridge, ilagay mo na lang sa machine na gene expert. Okay? And after 2 hours, meron ka ng result. Okay. So, ano ba ang ginagamit nating test? Normally, sabi ko nga sa inyo, AFB. AFS, acid fast staining, or yung tawag DSSM. But for DSSM, hindi ito yung gold standard natin. The gold standard for the diagnosis will be culture. Okay, for culture, inuulit ko, mamamatay na yung pasyente bago mo siya na-diagnose na may TB siya. Kasi nga umaabot ang culture ng 1 month up to 3 months bago mo makita may tutubo. Kaya mayroon na tayong, or may ginagamit na ngayon ng Philippines na bago, we have your gene expert. After 2 hours, malaman mo na mayroon ng result. Yan. Okay? So, yan yun. For gene expert, ito yung ating mga interpretation. MTB positive, Mycobacterium tuberculosis positive, NG after 8 weeks, meaning there is solid no growth after 8 weeks, yan. NG after 6 weeks, liquid no growth after 6 weeks, NTM non-tuberculosis mycobacteria. Sorry, yung interpretation na yun for growth ay for culture, and for gene expert ito yung ating interpretation. MTB detected, rifampicin resistance non-detected, T lang siya. RR, detected ang MTB, pati ang rifampicin resistance. TI, detected ang TB, rifampicin resistance now intermediate. And N, MTB not detected, and I, invalid, no result, or error. Ito yung lalabas sa ating machine. Okay? For culture media, don't worry, mabilis na lang tayo kapag natapos natin yung first part ng ating lecture, okay? For culture media, actually, the most important part here is that the culture media used now for the cultivation now of your Mycobacteria will be divided into two. You have your agar-based media and we have also your egg-based media. Okay? So highlight lang natin yung mga important na media na ginagamit natin for culture. Take note yung last na part dito, malachite green is an inhibitory agent for non-mycobacteria. So kung noon sa ating Neisseria species, gumagamit tayo ng mga antibiotics, dito gumagamit tayo ng malachite green. Okay, so inhibitory agent now for non-mycobacteria. Take note, yung incubation natin dito, 35 degrees in a dark with 5 to 10% carbon dioxide with humidity. And take note, aerobic ang ating mycobacteria. Egg-based media. For egg-based media, for egg-based media, gumagamit ba tayo kadalasan ng autoclave dito? Normally, hindi. Bakit nasisira natin ang ating protein? Kasi nga, egg-based media to through coagulation. Pag once nagkaroon ng coagulation yung protein, nasisira natin siya, na-denature natin yung ating protein. Okay? So, best example nito will be your LJ or your Lowenstein. Lowenstein Jensen. Okay, so ano bang composition ng ating egg-based media? Tingnan nyo to, parang nasa kusina lang kayo. Sabi dito, fresh egg, okay, potato flour, we have your glycerol, and of course, we have your salt, your milk, and your potato flour. Di ba? So, ganun lang siya, ganun lang itsura ng ating egg-based media. Okay, again, malachite green inhibitory sa ating gram-positive bacteria, kailangan ilagay yan. So, sabi dito, for Lowenstein Jensen, this is the most commonly used media. Again, highlight nyo na yun. LJ, pag narinig nyo, Lowenstein Jensen. Lowenstein Jensen, ginagamit yan for Mycobacteria. Anong type siya ng agar ng Mycobacteria? Egg-based media. Ino-autoclave ba to? No, hindi sa ino-autoclave kasi nasisira natin, nako-coagulate natin yung itlog, na-denature natin yung itlog. Okay? So, next, itlog daw, yung protein, sorry. So, we have your graph or your modification of your LJ. Yan. So, we have here malachite green, penicillin, and nalilisic acid. Nag-add lang tayo ng mga antibiotics. Okay? Mycobactocell, nag-add din tayo ng antibiotics, cycloheximide, lincomycin, and nalilisic acid. And with pyruvic acid for your M. bovis. Again, for this slide, pamemorize po, Lowenstein Jensen, the most commonly used media now for your Mycobacterium. So, LJ with glycerol for M. ulcerans. Next, gusto ko i-memorize nyo to, Petragnani. Okay, so when we talk about Petragnani, it uses a higher concentration of your malachite green. Okay, so high concentration of your malachite green. And last, gusto ko i-memorize nyo ito, your American Thoracic Society. Okay, so American Thoracic Society, media, so gumagamit din siya ng 0.02% na concentration ng ating malachite green. Again, for the previous slide, and para sa slide na ito, sabi ko mayroon tayong tatlong agar na egg-based na pinaka-importante. We have your LJ or your Lowenstein Jensen, most commonly used. Petragnani, higher concentration ng malachite green, and of course, your American Thoracic Society. For agar-based naman, kadalasan to, tandaan nyo na yung word na Middlebrook. Okay? Ano mang Middlebrook yan? Middlebrook 7H10, 7H11, yan. For agar-base, it's composed now of your salt, of course, your vitamins, your nutrients, cofactors, your glycerol, your malachite green, and of course, your agar. Okay? So, Middlebrook, highlight lang natin dito. Yan. Middlebrook 7H10. Pa-memorize ito Middlebrook 7H10 is the preferred media for the AST or the microbial susceptibility testing. Ito yung ginagamit natin for your AST. Okay? So, Bingayan. Judrick. Nandyan ka pa ba, Judrick? Uy, wala na siya.
Hello, sir.
Judrick. Judrick, sa inyong AST or antimicrobial susceptibility testing, ano yung most common na ginagamit nating agar?
Hinton Miller, sir.
Miller?
MHA.
Okay, very good. Miller Hinton. Gaano kakapal dapat yung agar sa ganon, sa plate?
Ilang point
basta 0.4 ba yun? Nakalimutan ko na, sir.
4 mm, wag mo na i-point 4, masyadong manipis na yon. Okay? So, memorize nyo yung mga yan. But for AST natin, gumagamit, thank you, Judrick. So,
Yes, sir.
for AST natin, gumagamit naman tayo dito ng Middlebrook 7H10. Hindi po Miller-Hinton-Agar ang ginagamit natin, but your Middlebrook 7H10. Liquid media natin, we have your Bactec 12B media. Yan. Middlebrook 7H10, 7H9 broth, your septic check, and your BBL Mycobacteria growth indicator tubes. Yan. So, ganito po itsura ng septic check biphasic media system. Ganito po itsura naman ng ating ng ating Mycobacteria kapag tumubo sila sa media. Okay. So, normally, kapag sinabi mo kasing M. tuberculosis, kapag sinabing M. tuberculosis, cauliflower. Cauliflower appearance. Okay. Cauliflower. For automated system naman, meron tayo dito, Mycobacteria growth indicator tube, your MB Redox, ESP culture system, MB Bacti, and Bactec 900 MD. Huwag nyo hanapin ito sa pag-internship, kapag nag-intern kayo, huwag nyo hanapin itong mga to. Hindi lahat ng hospital meron itong mga to. Okay, so, yan. Next, ito ay matapos sa first part. Biochemical test tayo. For biochemical test, tingnan lang natin yung principle ng biochem test plus yung mga positive result. Okay? So, your niacin test or niacin accumulation test, normally this is used now for the presumptive diagnosis or presumptive identification, of your MTB. Okay? So, this is based now on the accumulation now of your niacin, a result of lack of an enzyme that converts niacin now into niacin ribonucleotide in your coenzyme pathway. Meaning, magpa-positive daw si bacteria kapag wala siya ng enzyme. Pag wala yung enzyme, hindi niya magagamit ang niacin. Pag hindi nagamit ang niacin, mag-accumulate yung ating niacin. That's why it's called niacin accumulation. Okay? So, reagent natin dito, cyanogen, bromide, and aniline. Positive result, yellow. Positive dito will be your M. tuberculosis. Nitrate reduction, hindi ito common or hindi ito ginagamit kadalasan na presumptive identification ni TB kasi madaming bacteria ang nagre-reduce ng nitrate. Okay? So, sabi dito, your nitroreductase catalyzes the reduction now of your nitrate to nitrite. Okay? And of course, use your hydrochloric acid, your sulfanilamide, and your N1-naphthyl diamine dihydrochloride, and of course your indicator, your zinc. Madaming nalilito dito sa zinc powder. Okay, so ano ba yung ating zinc powder? Yun nga tayo. Corpus, Julie May. Corpus? Ay, si Kevin parang nagsalita kanina. Talon. Kevin? Meron ka kanina. Nag-unmute ka kanina eh. Kevin Talon? Wala ka na. Natulog na rin si Kevin Talon.
Marami nang natulog.
Madaming natulog, ma'am.
Mahirap mamaya exam nila sa Mycobac.
Si Toscano. Di pala si Toscano. Ralph.
Wala ba si Dexter?
Si Dexter. Saan Dexter to, ma'am?
Padron.
Dexter. Dexter daw.
Wala din.
Katurog sila.
Keng! Asan si Pagador?
Si Pagador. Yan, si Pagador. Pagador. Dean's Lister to, mami. Pagador. Ayan. Pagador, explain mo nga sa akin yung gano'n, yung nitrate reduction. Ano yung reason kung bakit naglalagay tayo ng zinc dito? Ang dami nalilito dito, Pagador eh.
Saan, sir?
Sa nitrate reduction test. Actually, hindi lang to sa Mycobacteria, meron dito sa ibang bacteria. Ang reason natin paglalagay ng zinc dito, sabi niya, indicator. Ano ba yung principle nito?
Sir,
Pagador.
sir, di ba usually, sir, sa nitrate reduction, parang no color siya? No colorless yung ano niya, sir, yung
yung reaction na mangyayari. Tapos nilalagyan lang ng zinc to determine yung color. Zinc yung added para sa yun sir, sa color. Parang, yun sir, kasi sir, ang alam ko lang sir sa nitrate, dati siyang colorless. May sinabi si ma'am dati na colorless siya. Tapos, ayun ma'am, nagkakaroon ng color pag dinagdagan ng zinc. Ganun po.
Kapag sinabi mo bang ang positive reaction kasi dito is red color. Okay. Once na yung bacteria, sige, thank you Pagador, tingnan natin, isa-isahin nga natin siya. Okay. So, yan, for your nitrate reduction, kapag yung bacteria, sabi niya dito, meron yung enzyme na nitroreductase. Ibig sabihin, i-convert niya yung nitrate into nitrite. Okay. So, in case na naglagay ka ng zinc, in case na naglagay ka ang positive color actually nito, the positive result will be red color. In case na na-reduce natin yung nitrate into nitrite, using now yung hydrochloric acid and yung sulfanilamide reagent, magre-red yung ating media. But in case na hindi nag-red yung ating media, after ng paglalagay natin ng hydrochloric acid and sulfanilamide, okay, may mga indications ito. First, una, naglagay tayo ng zinc, biglang nag-red yung ating test tube. Positive ba siya for nitrate reduction, Pagador?
Sir?
Ulitin ko ang positive result natin dito, red, tama?
Opo.
Okay. So, after ng test mo, clear pa rin yung ating solution. Okay, clear yung solution. Ngayon, maglalagay ako ng indicator. Tingnan ko kung na-reduce niya talaga yung nitrate. Maglalagay ako ng zinc powder. Okay. Pagkalagay ko ng zinc powder, Pagador, biglang nag-red. Na-reduce niya ba yung nitrate? Na-reduce ba ng bacteria yung nitrate? Nag-red bigla. Nung unang test ko, clear naman siya.
Ay, yes, sir.
Na-reduce niya?
Opo. Ay, hindi, sir. Ay, sir. Sir.
Ano ba talaga? Okay. Sige. Okay, tingnan natin. Thank you, Pagador. Yan. Actually, ang zinc dito, hindi siya part ng ating reagent. This is an indicator. Indicator kung na-reduce ba natin yung nitrate sa nitrite. Meaning, kapag naglagay ka ng zinc powder at biglang nag-red yung ating solution, ibig sabihin may nitrate. Bakit? Nagre-react ang zinc sa nitrate. Okay, so ang magiging kulay niya, pink or red. Okay. Ibig sabihin, nung umpisahan natin sa pinakauna, nung ako nag-test ng bacteria, ang final pagkalagay ko ng hydrochloric acid at ng sulfanilamide, which is the reagent, ay hindi nag-red yung solution. Ibig sabihin, bakit kaya hindi nag-red? Okay? So, titingnan ko, first, ang pwedeng gawin ng bacteria, pwede niyang i-reduce ang nitrite into nitrogen. Ang problema, ang nitrogen, hindi siya nagre-react sa hydrochloric acid at sulfanilamide, kaya ang nagiging result niya ay hindi red, kundi clear pa rin yung solution. Okay. Ang tanong ko dito, positive ba for nitrate reduction yung bacteria? Ni-reduce niya yung nitrite into nitrogen gas. Hindi siya nakontento sa pagre-reduce ng nitrate into nitrite. Ang ginawa niya, na-reduce niya pa yung nitrite into nitrogen gas. Pagador, positive ba for nitrate reduction yung bacteria?
Sir?
Positive ba yung sa nitrate reduction yung bacteria?
Positive, ano sir?
Ulitin ko okay. Naglagay ako ng bacteria dun sa ating reagent, hydrochloric acid and sulfanilamide, clear yung solution.
Sir.
Okay, clear yung solution. Ang ine-expect kong color niya dapat ay red. Ibig sabihin ng pagkakaroon niya ng red color, meron siya ng enzyme na kailangan natin. Okay. But after some time, clear pa rin yung solution. Okay. Pero nung nilagyan ko ng zinc, clear pa rin yung solution. Gets mo, Pagador? Pagkalagyan ko ng zinc, clear pa rin ang solution. Okay. Ang indication ng Pagador, yung nitrate, ni-reduce ng bacteria into nitrite, ni-reduce pa rin ng bacteria into nitrogen gas. Ang problema, yung nitrogen gas, hindi nagre-react sa zinc, at hindi nagre-react sa hydrochloric acid and sulfanilamide, kaya clear pa rin yung solution. Ang tanong ko, Pagador, Positive ba for nitrate reduction yun?
Hindi, sir.
Bakit?
Kasi, sir, sir, ano kasi ang zinc, di ba, sir, sabi mo, ang
Nagre-react lang yan sa nitrite.
nitrite, sir.
Nitrate. Nagre-react lang yan sa nitrate.
Kaso kasi, sir, dun sa sinabi mo, na ano na, sir, na parang na-convert pa into another, ganun, sir. So, feel ko hindi na siya nitrate, sir. Kaya siya false negative kasi hindi na siya na-determine, ganun, sir. Kasi nag-convert pa siya into nitrogen gas.
Anong test mo, Pagador? Anong pangalan ng test mo?
Nitrate reduction, sir?
May naganap ba na nitrate reduction?
Oo, sir.
So, anong maging result dapat natin?
Dapat red, sir.
Red, pero clear kasi nasobrahan niya sa pagre-reduce, ginawa niya pang nitrogen gas.
Yes, sir.
Positive ba siya for nitrate reduction?
Oo, sir.
Good, yun ang sagot. Positive pa rin siya kasi na-reduce niya pa rin. Meron pa rin siya ng enzyme. Ano bang hinahanap natin, Pagador, sa test na ito? Presence ng nitrate reductase, yung enzyme na pinoproduce ng bacteria. Ibig sabihin na sobrahan niya lang. Okay. Ngayon, Pagador, last na. Okay. Clear yung solution pagkalagay ko ng bacteria doon sa ating hydrochloric acid plus sulfanilamide. Anong next kong gagawin? Para i-confirm, lalagyan ko siya ng zinc powder, tama?
Opo, sir.
Okay. Pagkalagay ko ng zinc powder, kanina, clear pa rin siya pagkalagay ng zinc powder. Ito naman, paglagay ko ng zinc powder, biglang nag-red.
It means, sir,
Positive ba siya or negative?
sir,
Positive ba siya or negative?
positive to, sir.
Bakit?
Sir, kasi parang meron na rin siyang, parang na-determine na, sir,
Na?
na may nitrate, sir.
Ulitin natin, Pagador,
Di ba, ano na, sir, nag-color na, sir.
Ulitin natin, okay.
Doon sa pangalawa,
Okay. Sa pangalawa, ulitin natin. For nitrate reduction, nilagay ko yung bacteria plus yung ating reagent, which is hydrochloric acid and sulfanilamide. Clear. Ibig sabihin, walang naging reaction. So, i-confirm ko siya through the indicator. Anong indicator natin?
zinc, sir.
Zinc. Okay. Pagkalagay ko ng zinc, biglang nag-red. Positive ba, sir, or negative?
Hindi na, sir.
Bakit?
Kasi, sir, hindi naman yan, parang, hindi na siya nag-capable ng nag-reduce ng nitrate.
Good. Ibig sabihin, na-confirm niya.
Nitrate na yung na-detect niya, sir.
Good. Very good. Ibig sabihin, na-confirm niya na yung meron dun sa ating solution ay nitrate. Okay? So, kaya siya nag-red. Take note, ang daming nalilito dito sa ating nitrate reduction test. Okay na, Pagador?
Yes,
Gets?
sir.
Okay.
Yes, sir. Yes.
Okay. Okay ba yung class? Baka madami hindi nakaintindi, So, chat niya lang si Pagador pag di nyo naintindihan. Iniulit ko lang, in case na ang first part natin sa nitrate reduction test, nilagay natin yung hydrochloric acid or yung bacteria sa solution ng hydrochloric acid and sulfanilamide at yung ating solution ay clear. Okay, dalawa ang pwedeng mangyari. Pagkalagay mo ng zinc powder, first option, bigla siyang naging red. Ibig sabihin, negative siya. Bakit? Na-detect niya na meron pa rin yung nitrate. Hindi na-convert ang nitrate. Okay, second option, clear pa rin siya pagkalagay ko ng zinc. Ibig sabihin, yung bacteria natin, wala nang nitrate doon sa ating solution kasi kinonvert niya into nitrite or nitrogen gas. Kaya clear pa rin siya. Okay? So, yan yung ating nitrate reduction. For nitrate reduction natin dito, positive ito for M. tuberculosis, your N. kansasi, zulgai, and your pertuitum. Catalase test, ginagamit natin ito para i-separate ang Staphylococcus and your Streptococcus. For catalase test, kakaiba ito kasi gumagamit tayo ng semi-quantitative method. Depende sa taas ng ating effervescence, kaya nga semi-quantitative method. At gumagamit tayo dito ng heat. Okay? Kaya tinawag yung test na heat stable catalase test. Okay? For the semi-quantitative method, tinitingnan natin gaano kataas yung ating effervescence doon sa ating test tube. Ang tawag nila dito column. Okay? So, the height of the column of bubbles of your oxygen formed by the action now of your untreated enzyme. For your positive result, less than 45 mm of bubbles. Negative naman, greater than 45 mm of bubbles. For heat stable catalase test naman, the ability to use now your catalase enzyme even after heating at 68 degree Celsius, di ba? Normally, when you talk about enzymes kasi, di ba, this is a protein or a type of protein And one of the characteristic of your proteins that mabilis ang ma-denature sa increasing temperature. Okay, so
Kaya natin para yung next isang row din naman. Ayan.
ay la. May
No, iba yun. Iba na ito, di ba? Oo. Oo.
Auntie Kathleen, naka-unmute ka. Okay, so again, for catalase test, we have your semi-quantitative method and we have your heat stable catalase test. Okay, so dinedetect natin yung presence ng enzyme catalase. Twin 80 hydrolysis, okay, for twin 80 hydrolysis, we detect the presence of the enzyme lipase. Okay, so take note, sabi niya dito, the pH indicator will be your neutral red and the positive result will be your pink color. Okay, so negative dito ang ating Mycobacterium tuberculosis. Iron uptake. For iron uptake naman, the conversion now of your ferric ammonium citrate to iron oxide. Okay, so positive color, rusty brown colony. Positive or distinguishes now your M. chenolae from other rapid growers. Negative, M. chenolae, iron uptake. For aryl sulfatase test, from the word aryl sulfatase, we have here the enzyme aryl sulfatase, which breaks down your phenolphthalein disulfide into phenolphthalein, forming now a red color. For the reagent, take note, your phenolphthalein. Kapag nakakita na kayo ng phenolphthalein, pwede na yan. Positive result, pink color. So mga positive dito, we have here your fortuitum, chenolae, cenope, and trivia. Pyrazinamidase naman. So, the enzyme hydrolyzes your pyrazinamide to pyrazinoic acid. Positive color, red pigment. This is now for your M. marinum. Okay, to distinguish M. marinum from your M. kansasi and M. bovis from your M. tuberculosis. Tellurite, meron dito sa ibang test. Take note, pag sinabing tellurite, parang ang tigas. And normally, sabi dito, the reduction now of your potassium tellurite into a black metallic tellurium. So positive color natin dito will be black. Okay. Urease test, same pa rin ito sa other biochemical test natin for other bacteria. So pink to red color, and this distinguishes now scrofulation from your Gordonii. For inhibitory test, importante lang dito, pa-take note lang yung NAP. Okay, yung NAP is the precursor for the synthesis of your chloramphenicol. So this inhibits now your M. tuberculosis complex. Kapag gumamit ka ng NAP at walang tumubo, ibig sabihin baka M. tuberculosis complex yan. Okay? So we have your NAP or your para-nitroacetylamino beta-hydroxypropiophenol. Other, we have here your thiophene 2-carboxylic acid hydrazide, sodium chloride tolerance, and growth on McConkey. Okay, growth on McConkey. Okay, dokie. Tapos na tayo sa first part. Let's have your, mabilis na lang to kasi tapos na natin yung ating biochemical test. Actually, ang focus dito will be the first part talaga, yung pang medtech, the specimen collection, processing, of course, cultivation of your bacteria. Ito na lang, tingnan natin pinaka-important characteristics ng ating mga bacteria. Again, this is a slender, sabi ko nga kanina, napakaliit nila under microscope. Okay, slightly curved, straight rod-shaped organism, and the cell wall contains now N-glycosylic muramic acid or your mycolic acid. Yung tawag ni mycolic acid. And this is the reason now for your acid fastness. They are aerobic and catalase positive. And of course, yung granules na meron sa kanila, M for Mycobacteria, match granules. Okay, so M for Mycobacteria, match granules. Okay, so pH requirement niya medyo slightly acidic, 6.5 to 6.8 dapat yung ating culture media. Again, for culture media, dinivide natin into two, egg base and your agar base. Pag sinabi natin egg base, sinong mga nandun? Si Petragnani, nandyan si Lowenstein Jensen, at nandyan si American Thoracic Society. Pag sinabi mong agar base naman, nandyan ang ating Middlebrook. Okay, Middlebrook. Start tayo dito kay Mycobacterium tuberculosis. Discovered by Robert Koch. Kaya ang tawag sa kanya, Koch bacillus. Okay, Koch bacillus. So, tingnan lang natin important characteristic niya. So, sabi ko sa inyo, this is a slow growing. Okay? Actually, matagal ang division ng isang cell ng ating Mycobacteria, umaabot ito ng 24 hours. Okay, bago ito mag-divide, hindi tulad ng other bacteria, ang bilis na magparami. Ito is slow growing, typically raised with a dry, take note, dry, rough appearance. Pag binanggit sa board exam nyo, this is slow growing, typically raised with a dry, rough appearance with a characteristic of cauliflower colony, cauliflower-like colonies, yan, Mycobacteria. Okay? This is a non-pigmented, buff-colored colonies, and the longest replication time, umaabot ng 20 to 22, normally sa ibang book, umaabot ng 24 hours. Haba, no? Okay, so yan, longest replication time. So, isa sa pinaka-shortest naman, we have your Escherichia coli. Okay, Escherichia coli. So, pathogenicity, tingnan natin yung mga important factors niya. We have your cord factors or your trehalose 6,6 dimycolate. Okay, this is the reason now for your cord formation under microscope. Yan. So, glycolipid responsible now for the formation of serpentine cord in your smear. When we call serpentine cord, parang sila naglilinya under your microscope. Okay? So, parang, alam niyo yung parang necklace na nakalinya, pero yung necklace kasi normally mga bilog yun eh. Pero imagine nyo, basilay siya. Okay? So, yan. Serpentine cord formation, ang responsible dyan will be your cord factor. Sulfatide naman, this is a glycolipid responsible now for neutral red reacting associated now with the virulent strain now of your MTB. Infection, we have here your primary tuberculosis. For primary tuberculosis, normally this is the disease now of your respiratory tract. Okay, and normally sa lungs makikita mo chronic granulomatous infection transmitted through inhalation. Okay, cough, sputum with hemoptysis. Okay, chest pain. Sino sa inyo meron ng mga to? Shortness of breath, yan, low-grade fever, night sweats, fatigue, anorexia, and weight loss. Di ba sabi nila, ang TB daw sakit ng mga mahirap. Pero normally, kasi dito for TB kasi normally ang mabilis kapitan dito yung mga mahihina yung immune system. Hindi mo alam ngayon, baka may TB ka na, hindi lang nagpapakita. Okay? So, clinical diagnosis, tuberculin test or tuberculin skin test. Diagnostic skin test now which identifies TB infection, recent or past with or without the disease. So, person infected with tubercle bacilli develop hypersensitivity. So, serology kasi ito. So, this is based now on the presence of induration o yung parang may erythema formation ka sa skin mo after kang tusukan ng ating tuberculin. So, types of reagent na ginagamit natin for tuberculin skin test, we have your old tuberculin. So, this is the original test reagent. Gumagamit tayo dito ng boiled 6-week-old broth culture, yung mismong TB, pero pinatay natin through boiling. And ang pinakasikat, we have your PPD. Kapag may mga binanggit sa inyo PPD, Purified Protein Derivative Skin Test. So, partially purified preparation from your old tuberculin test consists now of a mixture of small tuberculoproteins. Okay, ito yung most common na ginagamit natin, your PPD skin test. So, method of administration naman natin, ano yung mga different method natin? Intracutaneous, ang tawag sa intracutaneous, Mantoux test, scratching, von Perquet test, yan, piece of cloth, soak in your PPD, tapos ilagay mo sa skin ang tawag, Volmer patch test, OTPPD plus lanolin ointment, rub on your skin, Moro percutaneous test, and your multiple puncture technique, your tuberculin time test. Normally ginagamit natin dito will be your Mantoux test. Actually, ito halos ginagamit to sa mga bata. Okay? Bata, okay, sa mga clinics yan. Ito ginagamit Mantoux test. Reactive and positive result indicates now a past exposure to TB. So reading and interpretation, so should be read 48 to 72 hours, 2 days to 3 days after injection. So anong itsura dapat? May erythema and induration. So i-measure mo 'yon, greater 10 mm or greater than 10 mm infection with TB, greater than 5 but less than 10 doubtful may be due now to other mycobacterial infection. Okay? So, erythema without induration naman, negative, retested with 250 TUDS unit. Okay, so yan, erythema with injuries. Again, positive natin dito, greater than 10 or 10. Ito yung sinasabi ko sa inyo, extrapulmonary TB. So, wag nyo nang sabihin na pag sinabing TB ay lungs na agad. Meron tayong intrapulmonary, yung binanggit kanina, and we have your extrapulmonary. For extrapulmonary disease, we have here your miliary TB, and we have also your PATS disease. For miliary TB, sabi niya dito, outside your lungs, primarily dito sa inyong hematogenous organs like your bone marrow, okay, your spleen, your liver. Actually dun sa ating mga system sa anatomy, may tinatawag tayong reticuloendothelial system. And in hematology, pag sinabi mong reticuloendothelial system, normally may kinalaman to sa blood eh. We have your spleen, your liver, your bone marrow, yung mga yan. Ay part ng reticuloendothelial system or your RES. So ito yung spread ng ating TB normally through hematogenous spread. POTS disease naman, normally tinatawag nating skeletal TB, okay, your tuberculosis spondylitis. So invasion na of your TB normally in your spinal vertebra. Okay, so baka may biglang bumubukol-bukol na lang sa inyo. Okay, so common characteristic nito, kapag sa vertebra, of course, back pain. Common site natin dito, we have your hip and your knee joint. Okay, so pwede ding ma-infect pati yung ang inyong joints. Kaya nga may specimen tayo kanina na synovial fluid. Okay? So again, for extrapulmonary TB, we have your miliary and your PATS disease. So other infection or other sites, of course, inyong pleural fluid or sa inyong pleura. So we have your pleurisy, so unexplained pleural effusion with mononuclear pleurocytosis. Biglang mataas nakita sa pericardial fluid or sa pleural fluid analysis na mataas ang WBC, in particular yung inyong mononuclear cells or your macrophages, yan, pleurisy. Lymphadenitis, yan, swelling, lalong-lalo na sa inyong neck, yan. Meningeal, ito yung tatawag nating tubercular meningitis. Genitourinary tract infection, peritoneal, of course, gastrointestinal. So yung treatment natin, for treatment natin, ginagamit namin ditong acronym RIPES. Okay? So we have your rifampicin, your isoniazid, your pyrazinamide, and we have your ethambutol and streptomycin. For second line, kadalasan kasi sabi ko nga sa inyo, MDR siya, multi-drug resistant. Ang problema kasi when we talk about your TB dots, your TB dots kasi dito, dapat normally kasi ang problema natin sa mga patient natin is non-compliance. Hindi sila nagko-comply dun sa ating gamutan, yung gamutan na binibigay ng RHU or ng CHO. Ang nangyayari, nag-stop sila sa treatment, nagkakaroon tayo ng tinatawag na MDR. Ang mas malala, nagkakaroon tayo ng XDR, extremely drug resistant. Okay, so ang problema din, pataas din yung ginagamit nating klase ng gamot, kawawa din katawan ng patient natin. So we have here your second line natin, aminoglycosides, your fluoroquinolone, cyclosporine, etanamide. Yan. For newly diagnosed patient, kailangan natin ng isoniazid and of course rifampicin for 9 months. Okay, pero sa TB dots, medyo pinaikli yung gamutan na. Okay, so yan, treatment. So yun tinatawag sa inyong MDR and your XDR, extensively or your extremely drug-resistant TB. Okay, so ito yung fight ngayon ng ating microbiology or sector ng microbiology, lalong-lalo ng bacteriology. The presence or the emergence now of your drug-resistant bacteria. Yung mga antibiotics na ginagamit natin, normally, sa kanila ay hindi na sila napapatay ng mga antibiotics na yan. Ang problema natin, pag tinaasan naman natin ang dosage, kawawa naman yung katawan ng ating mga patient. So please lang, kung may mga kakilala kayo na may TB, sabihin mo ituloy mo yung treatment kasi kawawa din siya. Pwede ma-develop yun into MDR or XDR kapag di siya nag-comply. Ang problema kasi natin dito is your non-compliance. Ang problema din natin, kaya nga pinagbawal na yung ganun yung over-the-counter ng mga antibiotics. Kung sino-sino may access sa antibiotics. So I think isa sa mga reason din natin kung ano-ano pinag-iinom natin. Okay? So please lang ito, MDR and XDR. So biochemical test, binanggit ko kanina yung ating niacin test, pa-memorize yung ating niacin test. Yan, nitrate reduction, of course, catalyst, positive siya. Negative siya for heat stable. and aryl sulfatase, and positive siya for pyrazinamide. Normally, ang nilalabas nilang first biochemical test dyan will be the niacin, the nitrate, and the catalase. For catalase, huwag nyo nang i-memorize yan kasi halos lahat naman sila dyan sa catalase positive. Characteristic nila yan. Okay? Niacin and nitrate, yung dalawang N, niacin and nitrate, positive ang ating MTB. So, virulence, binanggit na natin yung serpentine cord formation. Yan, itong neutral red dye test na lang. So, your neutral red dye test, itong ginagamit natin for your sulfolipids, yung binanggit din natin kanina. Okay, positive color, red color, 37 degrees Celsius for 1 hour ang ating intubation. Bovis. So, banggitin lang natin yung pinaka-important characteristics ni Bovis. For M. bovis, ginagamit natin ito for the development now of your Bacillus calmette-guerin. This is an attenuated strain now of your TB, Mycobacterium bovis ang tawag, okay, and used now for the vaccination of newborns against TB. Okay, so Mycobacterium bovis, inuulit ko, B for Bacillus calmette-guerin. Take note, to differentiate your M. bovis from your M. tuberculosis, positive ang ating niacin and nitrate kay tuberculosis, negative siya kay M. bovis. Africanum, associated now with human cases in Africa. Okay, yun lang, Africa. So, Mycobacterium carnetii smooth strain. Bakit? Normally, rough ang colony ng ating Mycobacterium. But for smooth colonies naman, characteristic ito ng ating carnetii. And of course, microti naman normally for immunocompetent and immunocompromised patient. But for immunocompetent and immunocompromised patient, lalo na sa mga immunocompromised patient, ang tatandaan natin dito, those who are suffering now from your AIDS, normally, ang i-associate niya doon will be your MAC, Mycobacterium avium intracellulare or Mycobacterium avium complex. Next, we have here your non-tuberculous Mycobacteria. Hindi sila under sa tinatawag nating MTB complex. MTB complex. So we have here your non-tuberculous Mycobacteria, also known as your atypical Mycobacteria other than tubercle bacillus, anonymous, unclassified, unknown, tuberculoid, environmental. Ano mang tawag mo sa kanila, basta hindi sila classified under your Mycobacterium tuberculosis complex. So, for your Runyon classification, pag binanggit sa inyo ang Runyon classification, okay, para ito kay Mycobacteria. Okay, sa ating Streptococcus kasi meron tayong Lancefield classification. Dito naman meron tayong Runyon classification. The classification is based now on the development of your pigment. So, we have here your Runyon classification 1, 2, 3, and 4, your photochromogens, cotochromogen, non-photochromogen, and rapid grower. Actually, ito yung pinaka-importante nyo tatandaan. Okay? Pag sinabing photochromogen, there is a development of pigment upon exposure to light. Okay? Photo, light. Okay? Chromogen, chromo, color. Okay? Magkakaroon siya ng color kapag na-expose sa light. Next, is cotochromogen naman, there is development of color in the dark or light and take longer than 7 days. Okay, so meron siyang color, may ilaw man or may light man or wala. Is photochromogen. Non-photochromogen, non-pigmented. Yun lang. Okay, so non-pigmented, non-photochromogen. And last, we have your rapid growers. Kasi nga sabi ko nga, characteristic na Mycobacteria, matagal ang kanilang replication time. But for rapid growers, sabi niya dito, rapid growth on solid media, normally fewer than 7 days or less than 7 days. Rapid growers. Yan yung mga under doon. Okay? So, kayo na bahala sa table na ito. Alam ko napaka-busy ng table na ito. Okay, ang dami. So, we have your photochromogen. Nandiyan si Kansasi, Asiaticum, Marinum. Yung pinag-importante, Kansasi and Marinum. Sa number 2 naman, we have your Zulgai. Yan. Scrofulaceum. Ano pa ba dito? 3, Cenope avium complex. Ano yung si avium complex? Non-photochromogen. And 4, Fortuitum, Chenolae, and Smegmatis. Ganito po itsura nila. Yung isa po, ilalagay natin sila sa yung isang container natin, yung isang culture natin, ilalagay natin siya sa dark na room. Yung isang culture natin, ilalagay na naman natin siya dun sa room na may light or sa may light source. Kapag tumubo lang siya dun sa may light source, ibig sabihin photochromogen. Kapag tumubo siya sa may dark at saka sa may light, scotochromogen. Pag walang tubo, walang tubo daw. Pag walang pigment, pigment dapat yung term. Pag walang pigment, kahit may tubo pero walang pigment, non-photochromogen. Ulit ko pigment ang titingnan natin dito. Pag may pigment sa light, wala sa dark, that's photochromogen. Kapag both dark and light, scotochromogen, and non-photochromogen pag walang pigment. So, tingnan lang natin pang important parts lang nito. Photochromogen natin, pinaka-importante natin dito will be your Mycobacterium kansasi. For Mycobacterium kansasi is also known as your yellow bacillus. Kasi later on yung culture niya, tingnan natin. Okay? So, the second now to mark to cause now your non-tubercular lung disease. Pa-highlight nun. Second to mark to cause now your non-tubercular non-tubercular or non-mycobacterium tuberculosis lung disease. Okay, so it causes now your chronic cavitary pulmonary lesion. Biochemical test natin, tingnan natin. Strong catalase test compared now to your MTB. Nitrate reduction, positive, but niacin, negative. Kanina, positive ang niacin, positive ang nitrate. Dito naman, negative ang niacin, positive ang nitrate. And pyrazinamide production, positive. Yellow bacillus, Mycobacterium kansasi. Mycobacterium marinum, nasa pangalan niya yung kanyang clue word. Sabi niya dito, normally, it causes swimming pool granuloma. Okay, swimming pool granuloma, Mycobacterium marinum. Okay, so optimal temperature for growth, 28 to 32 degrees. So, biochemical test natin dito, twin 80 hydrolysis positive, weakly catalase positive, niacin negative. In contrast now, palagi nyong tingnan si MTB, parang siya yung standard natin, siya yung comparator natin. Okay? So, urase and pyrazinamide naman, positive. Again, yung una natin kanina, kansasi, yellow bacillus, kansasi, Mycobacterium marinum naman, swimming pool granuloma. Okay, dalawa lang binanggit natin under photochromogen. For scotochromogen naman, scrofulaceum. For scrofulaceum naman, we have here the agent now of cervical lymphadenitis in children. Okay, so take note, for the biochemical test, twin 80 hydrolysis in contrast now with your marinum. Yan. So we have your urase positive and catalase positive. Mycobacterium zulgai. So this is closely resembles now your malmoense. Okay. So extra pulmonary disease like your TB and extrapulmonary like your lymphadenitis and your bursitis. So biochem test, nitrate reduction positive and inability to growth now in sodium chloride. Zulgai. Gordonei, your top water bacillus. Okay? Your top water bacillus. Take note binanggit ko kanina dun sa paggagargle, huwag kayo gagamit ng tap water. Okay, siguro alam niyo na ang rason. Baka magkaroon kayo ng false positive na TB siya kasi nga meron tayong tinatawag na tap water bacillus. Okay, so we have your Mycobacterium gordonei. Okay, so sabi dito, biochemical test, twin 80 hydrolysis positive, it's stable positive, and in contrast now with your TB or MTB, nitrate reduction negative siya. For non-photochromogen, pinaka-importanting binabanggit ko kanina pa, Mycobacterium avium complex or your Mycobacterium avium intracellulare complex. Okay, so we have here your M intracellulare, also known as your Bati bacillus. This is the most common environment saprophytes. So most common cause of pulmonary TB, pulmonary infection similar to TB, and normally this is seen now in patients with AIDS. Inulit ko so associated sa mga pasyente merong AIDS. Okay? So heat stable catalase positive, niacin negative, nitrate negative. Okay? So tingnan niyo negative dito sa nitrate and niacin in contrast now with your tuberculosis or your MTB. So Mycobacterium avium subspecies paratuberculosis, the agent now of John disease. This is intestinal infection occurring normally in as a chronic diarrhea seen in cattle, sheep, goats, and other ruminants. So animal pathogen. Okay. So mycobactin is an iron-binding hydroxamate compound produced by your mycobacterial species, in particular your Mycobacterium flake. So Mycobacterium genevanse, tingnan lang natin. Disseminated infections again with AIDS, okay, enteritis, genital, and soft tissue infection. Gastri, your J. bacillus, okay. So hydrolyzed twin 80 rapidly, catalase negative, again nitrate negative, positive ang ating tuberculosis. Haemophilum, from the name haemophilum, sabi niya dito, requirement niya for growth, hemoglobin or your hemim. Okay? So later on, babanggitin sa inyo si NAD at saka si hemin, lalong-lalo na sa Haemophilus species natin. Pero dito, Haemophilum, Mycobacterium haemophilum, kailangan niya ng hemoglobin and hemin for growth. Malmuense. For malmuense, sabi niya dito, halos resistant siya sa ating mga antibiotics. We have here your isoniazid, resistant sa streptomycin, your aminosalicylic acid, rifampin or rifampicin, but susceptible now to ethambutol and cycloserine. Okay, so niacin and nitrate, negative siya again. Tingnan nyo si tuberculosis, positive si MTB. Twin 80 hydrolysis and its stable catalase, positive. Simiae. So, from the word simiae, kasi nga po, this is first isolated now on the lymph nodes of monkeys. Okay, so pulmonary disease in patient now with pre-existing lung damage. Okay, so biochemical test, pinagkaiba niya kay MTB. Niacin accumulation, same sila na positive. But nitrate, negative ang ating simiae. Ulcerans, clue word pa rin yung kanyang species name. Yan. So, rare cause of your mycobacteriosis, aka now your Buruli ulcer. Okay, so this is the causative agent now of your Australian Burnsdale ulcer. Okay, so heat stable, inert in most conventional biochemical test, meaning halos negative siya. Actually, ang pinaka-inert na bacteria na makikilala nyo sa Enterobacteriaceae ay kadalasan si Shigella. Okay? So, pag sinabi mong Shigella, nananahimik lang siya. Okay? So, halos inert siya sa kanyang biochemical test. Mycobacterium xenophili, okay? Normally, ang highlight ng bacteria na ito will be the appearance of the colony on your cornmeal agar. Actually, cornmeal agar, ginagamit natin ito for the culture now or the cultivation now of your fungi. Okay? But dito, under cornmeal agar, siya ay bird's nest appearance. Okay? Bird's nest appearance. Xenopy, bird's nest appearance. So this is first isolated now in TUD or American TUD. Mycobacterium terrae complex. We have here M. terrae, M. trivale, and M. non-chromogenicum. Memorize lang natin yung mga common name niya. Radish bacillus, M. terrae. Kanina, J. bacillus. Ito naman, V. bacillus. And J. bacillus, kanina, gastri. Ito naman, trivale. V for V. bacillus. J kasi J. G. Parang magkatunog. Kaya J. bacillus, gastri. Okay, ito naman, trivale. Mayroong V dun. Kaya trivale, V. bacillus. Rapid growers naman natin, we have here, yan, Xenole, Fortuitum, and Smegmatis. Pamemorize yung tatlong yun, Xenole, Fortuitum, and Smegmatis. Yan, Xenole, rapid grower ng mga to. Yan, yan. We have also here Flay, your Hay Bacillus. Flay, Hay. Okay, so makakatunog-tunog yung mga yan. Okay, for Mycobacterium fortuitum, the most common rapidly growing mycobacteria associated now with localized cutaneous. Okay, take note, cutaneous and soft tissue infection. For Smegmatis, commonly considered saprophytic and is rarely caused now pulmonary skin or soft tissue infections. And of course, last part natin will be the cultivatable non-tuberculous mycobacteria. Nag-isa lang to. We have your Mycobacterium leprae. Characteristic, hindi mo siya pwedeng i-cultivate gamit ang mga ordinary agars. Ang ginagamit na cultivation or technique natin dito, gumagamit tayo ng mga animals, okay, for the cultivation of this bacteria. Okay? So your Mycobacterium leprae or your Hansen's bacilli or the agent now of your leprosy or Hansen's disease. So this is a rod shape, same silang dalawa ng ating Mycobacteria, yung general characteristic niya. So found in parallel or palisade arrangement like your cigar pockets. Later on, ma-encounter niyo ito kay Corynebacteria yung word na palisade. Okay, cigar pockets. Kung nakakita na kayo ng, syempre, kung sinong nakakita ng isang karton ng sigarilyo, parang ganun siya sa loob. Cigar pockets. Okay, so causative agent of your leprosy or Hansen's disease. This is a chronic disease of the skin, your mucous membrane, and nerve tissue. Normally, ang manifestation niya, of course, sa skin. Okay? So, two major forms now of your leprosy, tuberculoid and lepromatous. Napaka-importanting alamin natin to. For tuberculoid, sabi niya dito, skin lesion and nerve involvement that can produce areas with loss of sensation. Kahit kurut-kurutin mo yung tao, wala siyang nararamdaman sa'yo, joke lang. Wala siyang nararamdaman, yan baka tuberculoid leprosy. Okay? So this exhibit an effective cell-mediated immune response. Ibig sabihin, intact yung kanyang immune system. Kasi nga, kaya ng kanyang cell-mediated immune response. Normally, sino ba ang involved sa cell-mediated immune response natin? Si T lymphocyte. Okay, so si T lymphocyte, yan. Lepromatous naman do not produce an effective cell-mediated immune response. Okay, there is a skin lesions, progressive skin lesions, sabi niya dito, symmetric nerve damage. Ibig sabihin, pag may numbness sa kabilang kamay or sa right side, meron din sa kabilang kamay. Okay? So, treatment niya na natin dito, normally, Dapson lang to. Okay? So, simple lang ang treatment niya dito, Dapson. Okay. So, distinguishing characteristic lang po ng tuberculoid versus your lepromatous again. For distribution, for tuberculoid, localized and benign. Again, bakit? Binanggit kanina effective yung ating cell-mediated immunity. Lepromatous naman, disseminated, malignant. Yan, cell-mediated, effective sa ating tuberculoid, ineffective sa lepromatous. Presence in skin scraping, rare and often negative kapag nag-collect ka ng specimen sa skin scraping or skin nips. Abundant naman sa ating lepromatous. Symptoms, skin lesion, normally damaged nerve or few hypopigmented macules for tuberculoid leprosy. For lepromatous naman, there is facial and nasal deformities. Normally, biglang na-erupt yung kanyang nasal cartilage. Yan. Pagkahawak mo ng tenga niya, biglang natanggal. Pwede din yan. Yan, multiple lesions. Lepromin skin test, positive for tuberculoid leprosy. For lepromatous naman, negative. Napaka-importante yung last part, lepromin skin test. Positive for tuberculoid leprosy, negative for lepromatous leprosy. So take note, for M. leprae, humans are the only natural host. Actually, isa rin sa pinaka-old na disease ito. Nasa Bible pa to eh. Di ba? So kaya may tinatawag na leper house sa Biblia. Okay? Dahil doon ina-isolate or kina-quarantine yung taong merong leprosy. Okay? So human are the only natural host, take note. And the major portal of entry like your MTB is your respiratory tract. Okay? So others, pwede din to, biting insects. Uy, pwede pala yun. Okay? So, and breast milk. Okay? So, pathogenesis, this is an obligate intracellular bacteria. Kaya normally, under skin nips ninyo or under skin scrapings ninyo, under microscope, pag in-stain mo to ng acid-fast stains, makikita mo na yung bacteria ay nasa loob talaga siya ng cell. Ay normally obligate intracellular. Okay? And they have a strong predilection for nerve. Okay? This explains now bakit may nerve damage. Okay? Bakit may loss of sensation, lalong-lalo na sa mga free endings, sa free nerve endings mo, yan. 5 forms. We have your tuberculoid. Binanggit kanina, meron tayong dalawang primary, lepromatous and tuberculoid. Dito lang, tuberculoid, borderline tuberculoid. We have your borderline lepromatous. We have your lepromatous. Okay, but only 2 are stable. Okay, so yan yun. Ito yung lepromine test natin. Kamukha ito ng tuberculin skin test. Okay? Ito lang yung kamukha ito ng tuberculin skin test. Kung meron tayong tuberculin skin test sa MTB, sa mLepray naman may lepromine test. So this is skin test consisting of heat-killed suspension of mLepray. So but the main drawback for this will be it lacks specificity. So type of reaction, the early Fernandez and the late Mitsuda reaction. So when we talk about Fernandez reaction, bakit sa early? Magpapakita ang erythema and induration after 1 day to 2 days. Ang late reaction naman or late Mitsuda reaction, magpapakita ang induration or erythema after 3 to 4 weeks. Kung makikita niyo yung figure dito, yung mga red na part na yan, yun. Yan yung ating bacteria. Yeah. So again, specimen, nasal mucosal smear, skin snips, yan, eyebrows and other sites. So culture natin, hindi po natin pwedeng i-culture ito under normal culture media. Gumagamit tayo dito ng mga animals, like your armadillos, okay, pwede ding daga. Okay, nilalagay natin sa kanyang foot pad kasi it requires now low temperature, medyo mababang temperature compared sa normal. Okay? So non-culturable, again, using artificial media, and we can use now animals to grow them experimentally. Okay, so acid fast, of course, positive siya for acid fast staining. Syempre, acid fast under siya sa Mycobacteria, may mycolic acid. So bacteriologic index, the number of organism present in all immersion field, and morphologic index, the number of solid staining cells per 100 total bacilli examined. For serology, of course, we have your fluorescent leprosy antibody absorption test, DNA amplification, and ELISA. Okay, sir, sa lab, anong kadalasan ginagamit nating test? For lab, ang kadalasan ginagamit natin dito will be acid fast staining or acid fast smear using now skin snips as your specimen. Okay, as your specimen. I think this is the last slide. Okay. Oo siya, last slide na siya. Okay. Okay. May question po ba?
Questions?
Nakaturog na sila yan, ma'am.
Nakaturog na yata sila. O lalo silang nalunod na sa bacteriology. Enterobac kahapon, Mycobac ngayon.
Mahaba ang enterobac kasi halos kalahati ng enterobac.
Kaya nga, ang dami nilang tribo, ang dami nilang biochemical test. Diyos ko, Lord, have mercy. Oo. So, any questions?
None po, sir, kung none ni Toscano.
Sabi nga,
Toscano, tayo na lang magtanong kay Toscano, ma'am.